Hello and welcome to our channel. Today, we have some serious news coming out of Ethiopia that we need to talk about. It's important to stay informed, especially when it comes to public health. The Ministry of Health in Ethiopia has officially confirmed an outbreak of hemorrhagic fever in Jinka, a town in the newly formed South Ethiopia regional state. This is a developing situation, so let's break down what we know so far. According to a statement released by the ministry, there have been 8 suspected cases identified. 8 people are currently under investigation, showing symptoms that are consistent with a hemorrhagic fever. Now, what does hemorrhagic fever mean? It's a group of illnesses caused by several different families of viruses. You might have heard of some of them before, like Ebola or Marburg. These diseases are often severe and can cause bleeding or hemorrhaging, which is where the name comes from. Other symptoms typically include high fever, fatigue, muscle pain, headache, and sore throat. This is often followed by vomiting, diarrhea, and in some cases, both internal and external bleeding. Right now, the specific type of virus causing this outbreak in Jinka has not been identified. That's a crucial piece of the puzzle that health officials are working tirelessly to solve. Samples from the affected individuals have been collected and sent for laboratory analysis. The results of these tests will be vital in determining the exact nature of the virus, which in turn will guide the specific treatment and control measures needed. In response to this potential crisis, the Ethiopian Ministry of Health has acted swiftly. A rapid response team has been deployed to Jinka. This team is made up of experts in epidemiology, virology, and public health. Their mission is multifaceted. First, they need to pinpoint the cause of the outbreak. Second, they are conducting extensive laboratory testing on the ground. And third, their primary goal is to prevent any further spread of the disease. This is a classic public health response. Identify, contain, and treat, the ministry stated, and I quote, "The ministry, in collaboration with partners, is undertaking coordinated surveillance and response activities." This means they are not working alone. They are likely partnering with international organizations like the World Health Organization and other non-governmental health bodies that have experience with these kinds of outbreaks. This collaboration is absolutely critical for bringing in additional resources, expertise, and support. On the ground in Jinka and the surrounding areas, a massive public health effort is underway. Community-level monitoring has been significantly intensified. This involves health workers and volunteers actively looking for new cases within the community. Contact tracing is also in full swing. This is a meticulous process where officials identify everyone who has been in close contact with a suspected case. These contacts are then monitored for symptoms for a specific period, usually the maximum incubation period of the virus. If they develop symptoms, they can be isolated and treated quickly, which helps to break the chains of transmission. Furthermore, health teams are going house to house to find potential cases that may not have come to the attention of the health system yet. This proactive approach is essential because in many rural communities, people might not seek medical help immediately, either due to distance, cost, or a lack of awareness about the seriousness of the symptoms. The Ministry of Health has also issued clear and urgent advice to the public, especially for those living in or around Jinka. They are advising residents to seek immediate medical attention if they experience any of the hallmark symptoms. These include any form of unexplained bleeding like from the nose, gums, or in the stool along with fever, diarrhea, or vomiting. The key here is unexplained. If you suddenly develop these symptoms without a clear reason, don't wait. Go to the nearest health facility right away. Early diagnosis and treatment can significantly improve the chances of survival and also prevent you from passing the virus to others. In addition to seeking medical care, the ministry is emphasizing the importance of strict hygiene practices. This is a cornerstone of preventing the spread of many infectious diseases, including hemorrhagic fevers. They are urging everyone to practice regular and thorough hand washing with soap and water. If soap and water aren't available, using an alcohol-based hand sanitizer is the next best thing. Another critical piece of advice is to avoid direct physical contact with individuals who are showing symptoms. Many hemorrhagic fever viruses are spread through direct contact with the blood, secretions, organs, or other bodily fluids of infected people. They can also be spread through surfaces and materials, like bedding and clothing, that are contaminated with these fluids. So, maintaining a safe distance and avoiding physical contact with anyone who is sick is a key protective measure for the community. Health facilities across the entire South Ethiopia regional state have been put on high alert. They have been given specific instructions to strengthen their patient screening processes. This means that anyone coming into a clinic or hospital will be checked for symptoms of the fever. They've also been directed to immediately isolate any suspected cases to prevent transmission within the healthcare setting itself. Protecting healthcare workers is also a top priority, as they are on the front lines and at high risk of infection. Promptly reporting any new suspected infections to the central health authorities is another crucial part of this coordinated response, allowing for a real-time understanding of the outbreak's spread. So, to recap the situation, we have a confirmed outbreak of a yet-to-be-identified hemorrhagic fever in Jinka, Ethiopia. 8 suspected cases have been reported. A rapid response team is on the ground, and intensive public health measures like contact tracing and community surveillance are in effect. The public has been warned about the symptoms and advised to practice strict hygiene. The next few days will be critical. The results from the laboratory tests will be the most important piece of information we are waiting for. Once the specific virus is identified, health authorities can deploy more targeted strategies. For example, some hemorrhagic fevers have specific treatments or even vaccines available, while others rely purely on supportive care. Knowing the enemy is half the battle. This situation is a stark reminder of how vulnerable communities can be to infectious disease outbreaks, and how crucial it is to have a strong, responsive public health system. The quick action by the Ethiopian Ministry of Health is commendable, and we can only hope their efforts are successful in containing this outbreak quickly and effectively. For those of us watching from afar, it's a moment to appreciate the dedication of healthcare workers who run towards danger to protect communities. It's also a reminder of our interconnected world. A health crisis in one part of the globe can have far-reaching implications. We will continue to follow this story closely and will provide you with updates as soon as they become available from official sources like the Ethiopian Ministry of Health or the World Health Organization. It's important to rely on credible sources during events like this to avoid misinformation. If you found this update informative, please give this video a like and consider subscribing to our channel for more news and analysis. Don't forget to hit the notification bell so you won't miss any future updates on this or other important global stories. Thank you for watching, and please stay safe.